Earlier this afternoon, I learned that the latest COVID-19 percent positivity figure for Toronto is 5.9%. This means out of all the Toronto residents who tested for COVID-19 between November 1st and November 7th, just shy of 6% tested positive. The spread of COVID-19 has never been greater in Toronto. In recent days, we've seen the confirmed case counts rising to an alarming extent. Today, we're reporting 533 new cases of COVID-19. Yesterday, we reported 504. The total for the past 4 days is close to 2,000 new COVID-19 infections in our city. The temporary restrictions that were imposed last month were meant to create barriers to contact between people in order to limit spread. We have seen some success. In late September, we had seen increased case counts downtown in neighborhoods where socializing was high and that are home to many bars and restaurants. In the waterfront communities and the Island neighborhood, for the period from September 18th to October 10th, the COVID-19 case rate was 275 per 100,000 people. The temporary restrictions began on October 10th. And for the 3-week period ending November the 8th, the case rate had dropped to 49 per 100,000 people. In Little Portugal, another downtown neighborhood with a relatively young population and many bars and restaurants, the COVID-19 case rate for the 3 weeks ending October 10th was 604 per 100,000 people. And by November the 8th, it was 77 per 100,000 people. We don't want to surrender what we've gained from implementing these measures. For most of this time period, case counts remained stubbornly in the low to mid 300 cases per day. In recent days, we've seen local COVID-19 cases rise to more than 400 cases per day and twice above 500 cases per day. Admissions to hospital are rising slowly but steadily. The trend is upward. The grave risk we currently face is evident. More action is required to protect the people of Toronto from the rampant spread of COVID-19. Given the circumstances I've described, as your medical officer of health, I am using my authority to issue Section 22 orders under the Health Protection and Promotion Act to extend certain actions that are necessary given what the city is currently facing. This will sustain the following requirements for a 28-day period when the province moves us into its new framework on November 14th. Indoor dining will remain prohibited at restaurants, bars, and food or drink establishments. Meeting and event spaces will remain closed, as will casinos, bingo halls, and other gaming establishments. And the prohibition on indoor group fitness and exercise classes will continue. In addition, I am making the following strong recommendations to you: that all social gatherings be restricted to only household members and 1 or 2 essential supports, and that you restrict your close contact to those you live with and your essential supports. This means limiting in-person activities outside the home to essential activities only: going to work or school, healthcare, shopping for your household and health needs, and exercise and physical activity. At businesses and workplaces, I'm strongly recommending that they implement work-from-home policies wherever this is possible. Review their heating and ventilation systems to ensure that they are in good working order, and appoint a compliance officer to ensure implementation of occupational health and safety and infection prevention and control measures. My expectation is that these measures and recommendations can interrupt the transmission of COVID-19. But what these measures and recommendations need is you. It takes you to do these things to make it harder for COVID-19 to spread. I recognize that these actions will have economic impacts, and I am truly sorry for this. I really am. However, in my professional opinion, the greatest harm would be to allow COVID-19 to continue to spread at this rate. It's logical to assume that it will only get worse. It's logical to believe that if we effectively reduce the spread, that the economy will benefit in the long run. If action is not taken, we can expect to see even more cases of COVID-19, which means more illness and more death. These infections could easily spread further through the healthcare system, to the long-term care system, to schools, and to workplaces. To everyone in Toronto, I want to warn you in the plainest possible terms that COVID-19 is out there at levels we have not seen before. You should assume it is everywhere, and that without proper precautions and protections, you are at risk of infection. We can't guarantee what the course of illness looks like. We can't predict what the long-term effects might be. People recover from it who you wouldn't expect to live through it. And people you'd think would come through it can die instead. I urge you to limit your contact with people outside your home setting as much as you can. Be strict about keeping at least 6 feet apart from people you don't live with, as much as you can. Be strict about wearing your mask and washing your hands. These actions will protect you. In good conscience, we simply cannot stand by and allow COVID-19 to disrupt Toronto without resistance. COVID-19 has the advantage right now because it's spreading from person to person, from people spending too much time together, too close, and for too long. The virus only needs that opportunity. For the next few weeks, I urge you not to give it that opportunity. I'll now turn it over to Brad, and we'll take some questions.
Thank you, Dr. Davila. Just a reminder to reporters that you will need to unmute yourselves on WebEx. The changes to the WebEx platform require you to unmute yourself to ask a question. The first question is from Kelsey Mohammed at CBC News. Kelsey, go ahead, please.
Thank you for taking my question, Dr. Davila. Are you confident that staying in a modified stage 2 for another 28-day period is sufficient to get things under control?
So in fact, we are working with the provincial government to move into the new framework effective November 14th. And what I'm suggesting here are the actions that are necessary in concert with what's prescribed in the framework in order to manage the risk that we see right now in our city. We know what it takes to control COVID-19. We know what conditions actually lead to ongoing transmission and spread of COVID-19. So through these actions we're taking here today, we're doing our part as government, and I simply ask the people of Toronto to do their part as well. We do have to do this all together. Success in terms of controlling and beating COVID-19 does rest with all of us.